Dr. Lukoye Atwoli is a man I'll be speaking to in just a moment. But I still want to touch on what Asha has done in her story, painting that situation in hospitals. That is why everybody is talking about flattening the curve. But what is this curve and why does it need to be flattened? Well, it is very simple. This is what it is. This is the simulation right here. You can see here the number of people who've been affected versus the time from the first infection. This is a scenario everybody is trying to avoid, which is many infections all at one time. And as you can see here, overwhelming the capacity of the healthcare system. So imagine you have thousands and thousands of people who are infected with COVID-19 and require medical attention all at one go. Now remember, all of these hospitals and all of these institutions are not exactly empty. These hospitals are still treating persons with various ailments. So it's not like they're just sitting there waiting for COVID-19 patients. So you have a great overwhelming of the hospital system. In fact, not just that, but the entire economy. Now, what we're trying to do is this is what that curve looks like without any precautions and any interventions. Very many people at one point overwhelming the healthcare system. Eventually, the virus runs out of host, it'll die off. What we're trying to do in this country and the world over is to spread the number of infections over the course of time. That way, the healthcare system is able to keep up with the patients who need it, and they're able to get the masks and all of the equipment that they need. Now, you can see this curve that has been flattened here. That's due to social distancing, hand washing, staying at home. And this is the curve that we're all trying to flatten to avoid a situation of overwhelming our hospitals and indeed our economy. Now, one of those measures was, of course, the isolation of the 4 counties to prevent the spread of the disease from Nairobi, Kilifi, Kwale and Mombasa to the rest of the country. It's all about flattening the curve. So let's now speak to Dr. Lukoye Atwoli, who's the Vice President of the Kenya Medical Association. He's also the chair of the KMA COVID-19 Response Advisory Committee. Daktari, good evening and thank you for speaking with us. So let's start off with the isolation of the 4 counties. Besides just locking the residents in these 4 counties, what else should be happening in Nairobi, Kwale, Mombasa and Kilifi?
Yeah, so isolation is a basic principle of epidemic or pandemic control anywhere in the world. The first principle is that if you knew who was infected, then you would isolate those people and keep them away from the rest of the population until the infection has been controlled, and then they can be released to the rest of the population. Now, if you do not know all the people who are infected, but you do know that in a particular geographical area, there are a large number of infections and the probability that they are still spreading is high, then you could lock up that geographical area, isolate it, and then make every possible effort to identify who is infected within that area so that you can isolate them, remove them from the population until the virus dies down, until the area is safe again. So what should be happening in the isolated geographical areas is that we should be making efforts to ramp up the testing and tracing of contacts and isolating them so that at some point we can say we have a pretty good idea about how many people are infected, where they are located, we have an idea about where they are, and we can then start looking at other measures for the rest of the population.
All right.
So you don't just... Yeah.
All right. And Daktari, you were talking about what should happen in the 4 counties, but then what should be happening in the other counties, in the rest of the country? We're hearing talks of mass testing, but surely we cannot test 47 million Kenyans. So do you do random testing? Who do you test? Who do you not? What should be happening in the rest of the country?
So the trouble we have right now is that we have identified these 4 counties and have isolated them. The problem is we do not actually know the situation in the rest of the country. It's just that we haven't done enough testing in the rest of the country in order to know whether there are other counties that are affected. And therefore, after isolating these 4 counties, it is necessary to go out of those counties and do surveillance to identify if there are any other areas where this infection is spreading in the community. And as you say, it is difficult to test everyone. That would have been ideal. If we were a population of 10,000 people, we test everyone, then we know. But because that is not possible, then it becomes necessary, firstly, in those other counties to be very vigilant and test everyone who shows up with respiratory infections, new onset respiratory infections, they must be tested. And then beyond that, you can do surveillance where you go in and randomly test sections of the population in order to get an idea about whether this thing is spreading in that community or not.
And what happens after the 21 days? I mean, I think we've got less than 20 days now since the isolation of these counties was done on Monday this week. So what happens thereafter? What does flattening the curve look like? Now we've explained to our viewers what that means. But so 21 days, what would the numbers that would be sufficient to say, all right, you know, Nairobi and these other 3 counties are looking good, and then what?
Yeah, so you would decide. I mean, 21 days is a figure that is a hopeful figure that is given, that within those 21 days we might be able to bring everything under control. But that is really hopeful. The only way you will decide that the place is safe is if you test as many people as possible and start getting that most of them are negative. There are very few new infections coming in, and so the numbers start going down significantly and consistently. That is the definition of a flattened curve, when new infections keep dropping with every passing day, and therefore the total number of people who are infected increases at a lower rate than it is at the moment. Then you can say that the measures you are taking are now being effective. And the only way to tell is by doing testing in order for you to be able to say that the rates of infection are going down.
My final question is regarding the projections that were done by the DG, Dr. Amoth, talking about the possibility, and like we stressed, they are projections of 5,000 cases by mid this month, which is any time now, and 10,000 by the end of the month. What do you make of these projections, and what do we need to do to ensure that these projections do not become a reality?
Okay, so I think the projections are based on the fact that you are able to test, and therefore you are able to identify those 5,000, those 10,000. If you're not testing enough, there could be 10,000 people in the community who are infected, and we do not know. So that is the risk in this strategy. But if we are testing accurately right now, the projection of 5,000 at the time it was made was accurate. And then if it doesn't get there, which is the hope of everyone, it would mean that probably some of the public health measures that are being taken are being effective. If many people are keeping away from each other, then you reduce the risk of getting to the 5,000. If people are sanitizing, they're not touching their faces, they're keeping at home, then we reduce the risk of getting to 5,000 in the areas that we have isolated. But if that is not the case, then indeed the numbers could go up exponentially, and we may start seeing the more severe patients showing up in hospital, and that becomes an indicator that we should go out there and test more in order to figure out if the numbers are heading in that direction or not. So the only way to know is to test massively.
Massive testing. Thank you very much, Dr. Lukoye Atwoli, Vice President of the Kenya Medical Association. He also chairs the KMA COVID-19 Response Advisory Committee. Asante sana, Daktari.